here to do my informative speech. I'm here with my audience. Thank you guys for coming and for helping. Did you do yourself?
It won't let me. A reversal camera game away. And the camera person.
Okay, so my informative speech is going to be on how to start an IV. As an EMT and a future nurse, I think it's very important to have this skill because most of the time you will be starting an intravenous line or an IV on your sick patients. And once that IV is placed, you will be able to administer fluids or medications to your sick patients, which will help them feel better. And in many times it will also help them save their lives. So we're going to go over some simple basic steps on how to start an IV and go over some benefits and risk of having an IV. So first of all, you'll need to gather all the supplies that you need. We start with an IV start kit. You'll need an IV loop, a vacutainer, some blood tubes in case you need to draw blood at the same time, a pre-filled sodium chloride syringe, and I always grab some extra gauzes and some gloves, and your IV catheter. There is different sizes of catheters. It starts from small, which is a 24 gauge, and it goes up to 14 gauge, which is a larger gauge. And as you can see, they come in, you can use a small catheter or a long catheter. It just depends on your preference. So the next step is the setup. Do you want to come over here? Is the setup. You just open up all your supplies. Which I'm starting with the IV start kit. It comes with the Tegaderm, which is just a clear dressing to put over the IV site, ChlorPrep to clean off the area, some gauze, and some tape, and the tourniquet. Just get it all ready. And next you can open up your IV loop. And I usually connect the vacutainer to the IV loop and have it ready. Take the rubber band off the tubing, the blood tubing, and open up my pre-filled syringe. Open up the extra gauze. First thing you want to do is find a good site on the patient, which we usually use the bending of the elbow is a good place. And then we apply the tourniquet. And feel for a vein, which my patient has a very good vein. And then put your gloves on. And open up your ChlorPrep, which you'll use to clean off the site. Crack it. And then just wipe the area or the site that you're going to use. Pick your size, the right size catheter, which my preference is I use the Schwartz catheters, and I use a 20 gauge catheter. So you would take off the lid, and you have your needle, your catheter ready to use. The catheter has a bubble size or a bubble end, which that should always be up when you're going to insert it into the patient. So you would insert it with the bubble up, and you'll know that you are in the vein when you see a flash of blood. So once that happens, then you can advance the catheter and take your needle out, which then the catheter would stay in, and then you would apply your Tegaderm over the IV to keep it in place. And then apply your IV loop. This is where you want to hold some pressure on the IV so that you don't get blood everywhere. And this is where I use my extra gauze. I put it underneath, and then I apply the IV loop. Once this is done, you can start drawing blood by inserting the tubes into the vacutainer. And then once that is done, you clamp it off. Take the vacutainer out. And you want to flush the line with the pre-filled syringe of sodium chloride. And you just put the chloride into the IV just to flush it. Once that is done, then you take off the tourniquet. And take the tape part off of the IV and tape it down. Tape it nice and secure. Just tape it down and secure, and then you have your IV ready to go. It is now ready for you to put in fluids or medications to help your sick patient feel better. And that is basically all the simple steps of putting in an IV, or how to start an IV. Some of the benefits of having an IV is that you can not, usually you'll have sick patients that are dehydrated maybe. They've been sick with nausea or vomiting, or they haven't been eating or drinking anything. So they're probably dehydrated, so you can hydrate them with administering fluid. You can also give them some medication, for example, pain medicine, which will absolutely help them feel better, or some antibiotics, which will prevent infections or help heal an infection. Some of the risks are you can get an infection at the site, which is called phlebitis, and that is when the vein, inflammation of the vein where the sites of the IV is at, and that usually requires you to take the IV out and insert it in a different area. You can also, what else? Another risk is that you can have a needle exposure, get a needle stick injury, which will expose you to different kind of illnesses like hepatitis C or HIV. Another risk is infiltration. This is where the fluid will infuse into outside of the intravascular area into the tissue, and you'll get some swelling. So that also will require you to take out the IV and insert it into a different area. But definitely the benefits outweigh the risks. So it's definitely worth learning how to put in an IV. And I think that's it.